Thank you everyone for joining us. We do have a small group, but once again, I'm going to record this so if people want to watch it later, they can. This was a topic that people brought up as being interesting or something they wanted to learn more about. And first aid is not my forte. So I'm lucky to have Sarah Holloway, who's from Bighorn County here to share with us some basic first aid tips that you may hopefully be able to use in your club and possibly project meetings. So Sarah, it's all yours.
Thanks. So a little bit about myself. I've been a mom for 18 years. I have two kids. My son is graduating in a couple of weeks, so it's a little stressful in our lives right now. I have been a 4-H volunteer for, I think, 10-ish years. I mean, who knows at this point? I can't remember. And then I am also a shooting sports leader, and I think we've been doing that for about 8 years. I have been an EMT on and off for approximately 20 years, but most recently, for the last 10 years, I've been an intermediate and advanced EMT. I am also on search and rescue in our county as a volunteer, and I've been on that for approximately 15 years as well. So I'm really not bored in my life. I always am doing something. I also am a full-time vet tech at our local veterinary clinic in Basin. So a little bit about first aid I was going to talk to you guys about, and at any point, if anybody has any questions, I have the chat thingy open. I'm not very good at Zoom, so bear with me. If you type it in or just pop on here and holler. I also will warn you, my Wi-Fi is terrible at my house, so if it's bad, let me know. So I'll start with first aid. And if you guys have questions that I am not covering, or if you have a specific question about something that I didn't cover, let me know, and I'll do my best. So regarding first aid, I love just Walmart or Walgreens or any store that just has like a basic first aid kit. And then what I do is I mom it up and I add like 1,000 extra things to it. So I think this thing started with some Band-Aids, some sting repellent, some cleaner, and some like aspirin and Benadryl, and tongue depressors. I don't really know. So I threw in moleskin and cold compresses and trauma shears because I love trauma shears for everything, and some gauze and like whatever else you can think of that you may need. Band-Aids are pretty much the most important. There should be some kind of a flush material in here if you had ever needed to flush a wound. I find that it expires and it freezes in Wyoming, so I don't carry a whole lot of fluids because I keep it in my truck at all times and it'll be frozen if I need it. So I don't tend to deal with that. Usually somebody has a bottle of water that you can flush a wound with if you needed to. So we're going to start with some like superficial burns. And superficial just means like top of the skin. It's not a deep burn. And what you'll do is you would remove the heat source, obviously, whatever's burning, say your kid or the 4-H member, we're adult, and you're gonna want to run cool water over it, over the burned area, not cold because that can cause a problem, and not hot because that can also cause a problem. So it's like lukewarm, cool. And you're going to want to run that for 3 to 5 minutes. So what you're doing is trying to cool the temperature of the skin down to back to normal so it doesn't continue to burn. You never apply anything like butter, oil, grease, gloves. Like say I burn my finger, there's an old wives' tale to put butter on it and then you put a glove on it, and that's like a terrible idea because you're going to make it so much worse. So you flush it 3 to 5 minutes with cool water. You can apply an aloe gel or like an aloe type cream to it. Never like an oil based like chapstick or like something like that. That is going to make it worse. And you can apply the gel, the aloe gel, as many times a day as you want, a couple times a day at best. Acetaminophen, ibuprofen, something to take down the pain if it's that bad, and you're gonna keep it clean. If it's really bad, you're gonna go to the doctor. For all this stuff, you're gonna go to the doctor if it's bad. This is just for minor stuff, minor first aid. Keep it clean. You can wrap it, and you're gonna want to wrap it with a sterile gauze. I don't know if anybody knows what like a 4x4 is but it's got like a coating on it, so it doesn't stick. Because once you stick, if anybody knows, it'll stick to the burn, and then when you pull it off, you're going to have all those fibers in there, and that's going to cause it to have an infection or cause it to be worse every time you pull that band-aid off. And then just kind of loosely keep it covered. You don't want to do it tight because you can cause some swelling and cause some more issues that way. For deep burns, you're going to want to go to the doctor. Anything like sunburn or anything like that, you're going to want to, sorry, I was reading the chat thing. So deep, anything non-superficial, go to the doctor. So sunburns are superficial, minor burns like grease. Everybody cooks bacon and cusses it. That is a superficial burn. And so that is what I have for burns. Does anybody have a question on that? Okay, I'm going to move on to
no questions.
Okay, good. I'm going to move on to like small cuts, abrasions, and like punctures, I guess you could call it. Again, you're going to want to rinse well. And by rinse, I just mean clean water, clean faucet water, clean bottled water, whatever works. Sometimes I have been known to use iced tea, plain iced tea. It's what I have. That's what I use. So, and you can clean it well with like a mild soap. And again, you're going to rinse it well. Basically, you're debriding the cut of any dirt or anything like that and get it out before we dress it, if that makes sense. Then you're going to cover it. Again, you're going to cover it with cuts and stuff. You can do a Neosporin or some kind of an antibiotic ointment. And you're going to cover it with the Band-Aid or the gauze, and then you can wrap it. You're going to wrap it loosely again, because anything tight, you can constrict it and cause swelling and cause more issues. You're going to check it often. And then if it gets worse, so you notice pus, you notice drainage, you notice swelling, redness, streaks that go from the cut itself up, like say your arm or up your leg, that's bad. Go to the doctor immediately. So anything more than just like a cut and you clean it and deal with it, go to the doctor. Anything much deeper than that, depending on the body part, you're going to want to, same thing, wash it well, soak it potentially, and dress it properly and see a doctor. If you can't get it to stop bleeding, that's a concern that we can jump into. You're going to apply pressure to a bleeding wound, and just hold pressure on it until the bleeding stops. If you notice it, never take the dressing off. You're going to just keep adding more dressings and applying pressure. If you're comfortable with a tourniquet and it's that bad, I would say if you're comfortable and you know what you're doing, otherwise no tourniquets. That's typically saved for the professionals, because you can cause more harm than good with a tourniquet. So if you can get the bleeding to stop, you can elevate pressure, and then see a doctor if the bleeding is persistent. Questions on that?
I just want to reiterate, I just learned something new, that you don't pull stuff off, that you just keep putting more on. So that's something that I didn't know. So thank you.
With bleeding, yeah. Heavy bleeding. Sorry, if am I going too fast? Let me know. Super nervous doing this for everybody. I was gonna jump into concussions. And concussions is just a head injury. And believe it or not, it can be the most minor of things, my daughter just got one at wrestling, just by getting hit under the chin. Sorry, yes, we can go back. The streaks would be, so no, the streaks would be from infection. So say I cut my arm and I'm treating it and a day or two goes by and I notice like red streaks going away and up my arm. That is a serious infection, more than likely a staph infection that you're going to want to see a doctor. So streaks aren't from a new cut. It would be from an infection from a older cut. I would say within 24 hours if you're noticing that, but usually longer than a day. Any other questions on cuts or? Okay. So going back to concussions, just head injury. And it's just the brain just gets hit too hard against the cranium, your head, and it can be minor, it can be major. And sometimes you don't know how bad it is. I didn't know how bad it was until I think a day or two later with my daughter. And so she got hit under the head, like on her chin, and it kind of knocked her for like, she kind of saw stars, she said, but then she just went on and kept doing her thing. And then within a couple of days, she was acting really weird. She was really moody. She was really confused. She was lightheaded and nauseous, and she constantly had headaches. So we go to the doctor and he puts her on brain rest for 4 days. And teenagers are super fun to do that. And that means no light, no activity to the brain, no cell phones, no TV, no music. She was supposed to sit in a dark room for 48 hours or for 4 days. We lasted maybe 24 hours, if that. We did the best we could. So, but if you notice those things, typically they're minor and you're going to watch for vomiting. And they say not to let them fall asleep. I think that just goes to the passing out and how bad is the brain injury. So you just watch them for about 24 hours. If they get worse and you're noticing the symptoms, like I said, they may not remember the the injury, and they just seem dull, like they have no energy to do anything. Doctor, definitely the doctor. They'll put you on brain rest and you have to deal with that one. So, but there's not a whole lot. I mean, you can do Tylenol, but I think it's just to kind of calm the headaches and stuff down, but it's not really going to help until the brain is at rest and can stop working to its full extent. If that makes sense, it just needs to chill out. But there's not a lot for concussions. So if anybody had questions on that, I can just tell you the experience that I recently had. All right. From concussions, I was going to go into nosebleeds because those are super common. I actually just had a kid last night, had nosebleeds. Thank goodness his mom was there. The common, I guess, trick for all of us to do is you tip your head back and you hold pressure. And that is like the number one no-no. You don't want them to tip their head back because I learned many years ago, if blood is not where it's supposed to be, so like in your veins or in your heart, in your veins, it hurts. So the reason you get upset stomach and you start vomiting is because the blood is not supposed to be in your stomach. And that's what it's doing when you tip in your head back. It's going down and straight into your stomach and causing serious upset. So the key is to lean them forward, and you're going to pressure, pretty hard pressure. So if you can feel the hard part of your nose, just under that, it gets soft, and you're going to apply pressure to that. They say for 10 minutes. It's a really long time. I just try to hold pressure as long as possible until the bleeding stops. And sometimes putting some gauze in there helps, honestly, to keep the mess down, but not really to stop the bleeding, because you have to apply the pressure to stop the bleeding. And if it continues, you're gonna apply pressure again, hopefully for 10 more minutes. If it continues, then you're gonna go to the doctor or the ER, because I'm sure it's not during normal business hours. Never like, so once you get the bleeding to stop, the key is not to blow your nose, not to pick your nose, and not to rub it or mess with it, because you're gonna get that clot loose, and we can start all over again. So pressure, pressure, lean forward, and you can, like I said, apply, I put some tissues in there, or if you're a wrestler or a wrestling, you put the tampons up there and you take them out after a while. I usually take them out when they fall out on their own. Questions on nosebleeds? Okay. Okay. Going into choking, signs to look for choking. The common is, if you are choking, you're supposed to do this signal. I don't know if a lot of people know that, but they are going to grab their throat and they're going to have a just pure look of panic on their face. So if you see the look of panic, scared, they can't talk, they're confused, they are straining to make noise, or there's like a squeaking noise or a wheezing. Coughing is great. Coughing means they can breathe. So encourage them to cough, because if they're choking on something and they're coughing, hopefully they can get it up on their own. If it's forceful enough, if their lips and their fingers and their face are turning shades of gray or blue, they're not getting enough oxygen. So be prepared to intervene at that point. Don't ever stick your fingers in any mouth if they're actively choking, because you can push, say it's a piece of steak, you can actually push it down farther or cause more issues and truly cause them to choke worse, if that makes sense, and have an obstruction of their airway, not just a choking issue. If they lose consciousness, if you're close by, hopefully you can lower them to the ground carefully. And at that point, you're gonna start CPR if they're not breathing. And you could, if you knew they physically choked on, say, a piece of steak and they're not alert and they're no longer conscious, hopefully you can open their mouth and see it. And they call it a finger sweep, and you can finger sweep in there, but be careful because people bite. And but if they are you're gonna perform the Heimlich. If anybody knows that, they don't call it the Heimlich anymore, it's abdominal thrusts, and you're just gonna kind of go under. Let's see if I can do it for you guys. You're gonna go like, so right here is like, you know, my diaphragm and my abdomen, and so right under my ribs, you're gonna kind of make a fist, and you're gonna cover it, and you're just gonna like push in and up, if that makes sense. Fairly hard, and you're going to be behind them, and you're going to be hopefully pushing the air and pushing enough force that they can spit out whatever is in there. If it's a baby, you're literally hitting their back really, really hard as their head is down, and you're gonna, like gravity, hopefully it does its thing. It gets scary, so you just try to keep your cool. If at any point this happens, 911 is the first thing to call. Stop everything you're doing and send somebody to call 911. You call 911, because nobody can help if they don't know what they're doing. And 911 can at least be on the way. Worst that happens is you tell them, hey, we're cool, and then they go home. They will not be upset. Let's see. It's kind of all I had for like first aid, unless somebody had some specific questions on first aid. If they had like a specific situation or scenario. I guess the most important I feel in first aid is you keep mom calm, keep kid calm, keep dad calm, whoever is the adults. Try to keep them as calm as possible. I had a kid the other night that got a fletching in his um finger, like a feather fletching, and his life was not, he was not doing well. So I was trying to calm him down, put a band-aid on him, and he sent him home. But then later I found out he truly did have like some feather stuck in his finger, and my husband pulled him out. So I was like, well, that hurts. No wonder that poor kid was screaming so bad. But mom was calm, his aunt was calm. Just trying to get him calmed down was the best. I didn't have any running water, or I would have flushed it, but allergies, yeah. Allergies, like a kid that has allergies, or like an adult that has allergies, Benadryl is always awesome to give if you have it. Rarely is it going to hurt if it's, say, not an allergy or not an issue. I always err on the side of caution and go low. But if you're not comfortable, or if it's not a good situation, depending on what's going on, you can do Benadryl cream if it's like hives, or like a bite or an itch. Benadryl cream is not going to hurt, and I don't think too many parents would get upset if you put that on their child. As far as allergies go, to like the EpiPen situation, if they have an EpiPen and you know how to use it, fantastic. Or if they can walk you through it, fantastic. More than likely, you also will not get in trouble that way, because I feel like they would be thankful you're helping them. But Benadryl is always a good thing to keep on hand.
Sarah, can you borrow, don't they have like demo EpiPens that like usually fire stations or places can let you like check out so that you can learn how to use them that don't actually have the needle in them?
I just threw some expired ones away because I was keeping them for a rainy day. Um,
I've just
I
seen one without a
do,
needle, maybe. I don't know where I saw that.
um, I don't, I'm trying to think if I actually have one. And I don't think I do. So I don't, not to my knowledge. Usually once you hit it, the needle goes back in and it stays in. But an EpiPen, all it is like, it's a preloaded syringe for that particular adult or child, and that's their dose that they get. And what you're gonna do is take it out of its like tube packaging and take the cap off, because it comes with a cap. And I keep my thumb off of it until I'm ready to go, because this is a panic situation. If everybody's panicking and you hit it, it's going to be a really expensive oops. And you're gonna want to put it on, somebody's going to be real upset. Let's see if I can show you guys this one. You're going to want to put it like right here on their thigh. You're going to watch the seam of their pants. So you're going to want to put it on the outside of their thigh, and you're going to want to push it like truly, like kind of stab it in and then push, and you're going to keep it depressed for like 5 seconds. I'm not saying that needle is in the leg the whole time. Err on the side of caution, and that way you don't panic and pull it out too quickly. So yeah, if the person has an EpiPen, definitely give it if they feel they need it. Because if they have an EpiPen and they say they need it, it's needed. And if somebody's around that knows how to do it, or is more comfortable, like an EMT or like mom or dad or aunt or uncle, let them do it.
Just some things for leaders out there. Everybody can fill out a health form online with their enrollment, and you can access that or get that from your 4-H educator. So if you're worried about allergies, that's one place to go. However, as a parent, I know I don't always fill up my kids' health forms on Z Suites. And so there might be an opportunity at your first meeting to even have like a sign-in sheet where they might list allergies that you could put in a book for you to keep for future reference. That way, at least you know. In our 4-H club, we had a kid who was severely allergic to lots of things like wheat, peanuts, soy, all kinds of crazy things. And so his mom actually taught all of the leaders how to use the EpiPen and would drop him off and make sure he had it with him. So I think there might just be opportunities if you know you have some of those, just to have those conversations with parents ahead of time, especially if the kid's not going to be, the parent's not staying with you the whole time. I think that those are good conversations to have.
100% agree. I had a child that had seizures. Not my personal child. It was one of my 4-H members. We were doing an event. We were practicing or learning dancing, line dancing. That was at the meeting. And this kid started acting a little weird and started giggling, but it was kind of inappropriate giggling. And I was like, well, that's weird, but maybe he's super nervous. And he kind of started acting weird, and his mom, thank goodness, was there, jumped right up and took care of it. And she's like, well, that's his seizure. I said, I didn't know he had seizures. And she's like, oh yeah, I forgot to tell you. So that's an amazing thing. If you're a 4-H club leader, definitely have those parents fill that out, because I would have loved to know that child had seizures. So that just so it's in the back of my mind, if he's ever like off to himself, and or if I need to watch for certain things. Or same with the allergies. If you're just like, hey, he's kind of starting to sound a little weird, and I swear I notice a wheezing in the background, you can be more aware. Most of my parents now are really awesome and they stick around for the meetings. But there was a time that they did not. And so if something would have happened, I was there on my own. So does that cover allergies, or did you have like a specific question? Okay.
My guess is
So
you're good.
okay. Oh, thanks.
She
I don't
said
know about
perfect.
perfect, but thank you. So AEDs, I actually personally have one, which is ridiculous. But if you don't personally carry one at all times, a lot of places carry them now, and they're in every grocery store if you look for it. They're in lots of public venues. So I was gonna just walk you guys through mine, and it's really annoying. But I was gonna tell you, verbalize it first, and then I was gonna let you like hear it so you know what it sounds like, because almost all of them are somewhat similar, if that makes sense. So the number one thing with AEDs is whether you watch the event or whether you come up on an event that the person becomes unconscious or is unconscious, you automatically call 911. That's the number one thing you call for first responders to show up. The next is you're going to check for a pulse, because if they have a pulse, great, we can go from there. If they don't have a pulse and don't have an airway, you're going to be thinking, hey, somebody needs to grab this AED. Like I said, somewhere. Or if you know somebody who has one, you're going to send whoever for it. Usually it's one of my kids. So say the person goes down, or say, regardless, the person's on the ground laying there, and you check for the pulse. 911's already on the way. It's already been called. You check pulse, and there's no pulse, or there's a faint pulse. Regardless, you're going to start CPR. So CPR, and I'm not teaching CPR, I'm just telling you this is how AED starts. So you're going to start CPR, and you're going to do 30 compressions and 2 breaths. So you're going to do 30 compressions at 2 inches, right here, on the chest, and be prepared. If you're doing it right, there is some aggressive, and there is some ribs breaking, and that's normal for CPR. So you're going to start CPR, or have somebody start CPR while you're getting the AED ready. And the whole time you're getting the AED ready, you can open it up, and it's going to walk you through it. It's pretty awesome. But I personally used it by myself once. And I have done CPR for every year for many, many years, but I still panicked, and I still was like, I don't even know how to hook up an AED. That's why it walks you through it. Because when you panic, you need it. So you're going to have somebody doing the CPR while you're hooking it up. And if the chest is hairy, let's say it's a man, you're going to want to shave the spots. Sorry, right here, upper right. and right here, just below the armpit on the left. Make sure I'm lefty and righty. You're gonna shave it if it's hairy.
Do most AED kits have some type of razor in them?
They do not.
Okay.
So you do the best you can. I want to say I threw a razor in mine, and now I'm trying to think if I do. If I don't, I will have one here shortly. All the search and rescues do, because I went out and bought cheap ones and threw them in there. And so you're just gonna do like a rough shave. It's not perfect. Or if the chest is wet, you're gonna dry it because your pads won't stick to that. Or honestly, and it shows you on there where to put them. If like right here is really hairy, but right here is not, put it there. It's fine. That little difference isn't gonna matter. And if you don't have a razor, you don't have a razor. It is what it is. You're not gonna get deemed like knocked for not trying. So you're gonna apply them, and you never apply your pads over a pacemaker or a port. Don't panic if you don't know they have a pacemaker, but the ones that you see visually are like up here. Don't ever put your pads over that. Just put it to the side of it. And then so you're going to turn on your AD and you're going to follow the prompts. It literally tells you everything. So I was going to open it for you guys to hear it. And whoever hasn't seen one, I'll show you. So it is most of them in Wyoming. I know because Wyoming got this huge grant. They look like this, or they're exactly like this. So you're gonna open the lid, and it's in there. And so then you're gonna open the lid again. And it
adult mode.
So if you're not
Remove all
adult,
clothing from patient's chest.
you're gonna put it on child. And there's a child button. So it
Pull
tells you.
red handle to reveal pads.
You just pull
Look
that out.
at pictures on pads.
The pads tell you where to
Apply
put it.
pads to bare skin exactly as shown in the pictures. Press pads firmly.
So you're just gonna like slap it on
Pull
there.
red handle to reveal.
So these pads I can never get, they're always on back order, otherwise I'd pull them for you guys. So once you pull them, it has pictures on there of where they go. It doesn't have to be exactly like she said. You put them on, and you kind of press firmly. I just slap them on. And then from there, they're like are already plugged in. It is going to walk you through it. It's going to tell you stop CPR, clear patient. So you just make sure everybody is clear, because it can pick up on our electrical signal as well. And if it decides to shock, we can get shocked. So you want to clear everybody around, and then you push the button to see if a shock is advised. And it says push button, and it says shock advised, push button. So that's when you make sure everybody's clear and you push it, and then it shocks if it is shockable. And then it says continue CPR. So then you just write them automatic start CPR. And you can do this until 911 arrives, or hopefully until somebody else steps in. You can keep going on it until there's no shock. But if there's a shock, if it's a systole or it's gonna shock. So yeah. And that's like the worst thing ever, is hearing no shock advised, but yet you know that something needs to happen because people are watching. Did anybody have questions on that? I pray nobody ever has to use one of these, because it's kind of scary.
I would agree.
Yes, it will determine if they need shocked. That is not something you will ever decide. The AED will check the rhythm of the heart, and if there isn't a shockable rhythm, they call it, it will tell you to push the button, and it will deliver the shock for you. But like I said, make sure everybody's clear, because even if like a finger is, say, like on your ankle, you can get shocked, and then you're not helping anybody. Because at that point, your heart could stop too. And never do this in water. I mean, I think it's self-explanatory, but
It's good to remember. So I would also just say, if you know you're meeting at a certain location, it might be good to help identify where that AED is, just to kind of get everybody on the same page. So maybe that's something you could do at a 4-H club meeting, or at least have 2 or 3 leaders who understand where the first aid kit is and where the AED is, just in case something would happen.
absolutely. And I know we actually don't know anybody who has the first aid kit. I just know I always do. And I think everybody always comes to me because I have a jump bag in my truck at all times. And I'm weird and I always have some form of first aid on my person close by. So if nobody does have a first aid kit, somebody has something that you can make work, if that makes sense.
And I would just suggest, if you are having regular meetings, that maybe your club purchased one, or you could probably get one donated from maybe talking to your local fire department or your local ER or something. They could probably help you figure out what needs to go in it and would donate one if you can't. I don't know why you couldn't afford one, but if you can't, I'm sure there's places that would help you out with those kind of things too. But I think it's good to have one of those on hand, as if you're having a meeting and it's maybe not a one-time one, but if you're doing it over and over again, it'd be good just to have one with you.
True. That's kind of all I had, unless there was something somebody wanted to specifically go over or had questions on.
I'll let people think about that, but if not, Sarah, I want to thank you. You said you were nervous.
Oh.
You did an amazing job. So
Oh, thanks.
I really appreciate that. I also think just some things to think about. If you have a 4-H club, find people like Sarah in your community to come and speak at your club, and maybe even go through some of this with your 4-H members. You can, dress some bleeding oranges or something, but I think there's ways to make this interactive for kids. So feel free to make this one of your club meetings or one of your project meetings to talk about that. Sarah also said she worked for a vet, which also you can do a clinic or a similar thing with animal safety, especially since lots of us are dealing with those too. So just some ideas for future club talks or meetings. And so Crystal had a question about asthma attacks, so I'll let you take that one away.
Yeah. So asthma attacks are, again, it's gonna be, hopefully they have an inhaler. You're gonna try to keep them as calm as possible, because if mom or dad isn't there, or whoever is in charge of them, they're gonna panic and that's not gonna help. So asthma attacks are I don't know, I feel like those are scary. You're just gonna try to find their inhaler, try to get it in them the best you can, and try to get them calmed down the best you can. I don't know if anybody has asthma, but it's like literally, truly, their brain is like, I can't breathe. And they panic, and then they go into a panic attack, I think. So the first and foremost would be find the inhaler that child hopefully has with them. But I know several asthma kids that do not ever have their inhaler on them. In that case, you're gonna want to hopefully open up their chest and airway like as much as possible. Do not lie them down, because they're not comfortable lying down. If you ever see somebody having a breathing issue, they're like in a tripod position, they're like leaning forward and they're like opening up their chest as much as possible, like a bulldog stance, I guess, if you want to think of it like that. Because they're just trying to get as much air as possible, and their body is trying to figure out how to get as much air as possible. So, and then I would be on the phone as fast as possible to the parent or whoever to hopefully get or see what they want to do. If it gets bad and they can't breathe or it gets worse, 911 is always the best option. Does that help that question?
Good job, Crystal, with the questions. I'm impressed. These are things I didn't think about, so I'm
She's
glad that you
awesome.
brought them up. Yeah, she's on it,
Yeah.
for sure. All right. Does anybody else have any other things they want to ask a quick question about, or want Sarah to go more in depth with? She said,
Thank you. I did just think because crystals are so awesome. Going back to the seizures, not very many people have seizures. Rarely do I feel like it happens, but if a seizure ever happens, you want to clear that patient or the person and lay them down to where they can't harm themselves and they can't harm anybody else because they can't control it. Never put anything in their mouth. I never try to put anything in their mouth. The swallowing and the tongue thing, if you put them on their side and you try to somewhat hold them so they don't jerk and convulse as much as possible or hit their head. But don't stick your fingers in there because the swallowing and the tongue, if you have them on their side, they'll be fine. That's not really a thing. And you'll get bit.
Good information.
Yeah,
I
you
also
just try
just-
to stay calm, I guess, and keep them.
Sounds like that's 911, stay calm, keep everybody else
Always.
calm are the things probably to
Always.
think about first and foremost. And I think it's hard for us to remember to be calm because
Absolutely.
the situation isn't calming.
No, it's not. It's always scary.
I did just text Mary Louise, who had to leave, and let her know that maybe we can offer a CPR class as part of our volunteer summit in September. So look for that too if it's something you might be interested in doing. We're going to look to see maybe that might be something we can do in Casper during that thing. Because I think you're right. Like, obviously, you're not telling us how to do CPR. That might be something some of our 4-H leaders want to get some more training into. So,
Oh, I think CPR is, yeah. I think tons of people should have CPR training because
and if we can offer it
It's-
for free or pay for the person to come, I think that would be an awesome way to offer that service or that opportunity to our 4-H leaders.
yeah. And get with your local EMS. I know Burlington is volunteer, but I don't think it's very expensive. I obviously get mine paid for through the ambulance, but I think it's a valuable skill. Like I said, rarely have I had to use it, but in the off chance that I would need to use it, I mean, that's knowledge that you can't beat. So definitely like see when the next CPR class is and see if you can't jump in and get on that one.
So Chris's question is there an age limit for CPR? Do you know? I have no idea.
That's a good question, and I want to say no.
Okay.
I mean, like, yes, public health, absolutely. I want to say, I don't know if I would like think the littles, like your juniors, are gonna get much out of it, I guess, if that makes sense. But intermediates and seniors, absolutely. I know my kids took it in high school as that was part of their PE health class. And I don't know if they actually got like certified, but they still went through the class and they still have that knowledge. So I'm not 100% sure if you have to be 18 to actually do the class. I don't think so, but even if you did, and even if you attended the class and kind of got some of the knowledge, you can get first aid CPR. It's a little different than first responder CPR, but it's still CPR. So I don't think there's an age limit exactly, but.
And my guess is you could probably go through it and just not get the certificate if you weren't
Absolutely.
whatever age is
Absolutely.
probably
Yeah.
there. So I don't think it would be a bad thing. Or maybe you talk to your local county educator and your junior leaders could maybe do that as an activity for one of their months too. That would
Oh,
be
that's a good idea.
a cool
Yeah.
deal to get them that knowledge. So that way maybe you're just covering those high school age kids too. All right, these are great. This is the most interactive one I've had so far, so I'm pretty excited about this. Good job. I mean, they're very quiet, but it's pretty quiet most of the time. So
Right.
all right, anything else? This is great. Okay, well, I have all of your names recorded, so we'll make sure that everybody gets credit or it gets put in your account. And then also this will become part of our volunteer training offering. So if you know somebody who wasn't here that might want this information, within the next probably week, it'll be posted on our website to be able to grab that. And I'll email all of our educators and let them know that too. So, but once again, I would highly suggest reach out to people in your community to maybe do some of the same kind of things within your 4-H club meeting, and find a first aid kit and find your AED at your club meeting. So, yes.
Oh, I was like, no, I don't.
No, me, Sarah. Sorry, there's two of
Different
us.
Sarah. I was
That's
like,
good.
no.
All right. Okay, I'm gonna stop recording so that we don't get any other weird. There we go.